This PowerPoint is from Chapter 15, and it is titled Defining and Diagnosing Psychological Disorders. A psychological disorder is broadly a condition characterized by distressing, impairing, and/or atypical thoughts, feelings, and behaviors. So here we go back to this core idea of psychology of looking at the connection between thoughts, feelings, and behaviors. And a disorder is when it's distressing or impairing your life or just an atypical combination of these things. Conceptualizing psychological disorders is to label behaviors, thoughts, and inner experiences that are atypical, distressful, dysfunctional, and sometimes even dangerous. But let's look at what is considered atypical. What does that word mean? Atypical describes a state, condition, or behavior that is unusual or different from what is considered normal. Examples: an atypical behavior might be checking the lock on the door 20 times before leaving the house. An atypical thought might be hearing the voice of Satan telling you what to do. An atypical emotion might be depression so extreme that it affects your behavior and thoughts. So here again, we have that connection between our behavior and thoughts and emotions. Just as another reminder of that, because I think it's so important to look at this interconnection. Our thoughts affect how we feel and act. Our emotions affect what we think and do. And our behavior affects how we think and feel. Again, it's just an interconnected process. It is important to note as we're discussing behaviors that are atypical that some behaviors can differ among cultures. A cultural difference should not be considered atypical. We know that all cultures have different behaviors, and so if anytime you're looking at someone's behavior or a psychologist is looking to see if a behavior is atypical, it's important to recognize that if it's a cultural difference, then it's not considered atypical because it would be, quote, normal for their culture. So let's look at the origin of psychological disorders. Across many ancient cultures, the most prevalent explanation for mental illness was demonic possession. When individuals displayed behaviors like hallucinations, delusions, or extreme mood shifts, again, in ancient cultures, communities often concluded that malevolent or bad spirits had taken control of the person's mind and body. Another common supernatural explanation framed mental illness as divine punishment or moral transgressions or sins. Many ancient cultures also attributed mental illness to the influence of celestial bodies and cosmic forces. So this is a very ancient, older view of how psychological disorders developed. These interesting things, including things like this was demonic possession. Of course, we know this is not true at this point, but this is what original thoughts were. The biological perspective of the development of psychological disorders views them as there could be genetic factors, there could be chemical imbalances in the body, or there could be abnormalities in the brain. So that's a biological perspective of what creates a disorder. The diathesis stress model takes it one step further and integrates the biological perspective with the psychosocial perspective. The diathesis stress model suggests that people with an underlying predisposition for a disorder are more likely than others to develop a disorder when faced with adverse environmental or psychological events such as childhood maltreatment, negative life events, trauma, and so on. So the diathesis stress model again takes it a step further and says, well, people may have these genetic predispositions, but their environment's going to play a huge part in perhaps whether that genetic predisposition is displayed. So that's a little bit about where psychological disorders may come from, or the origins of those disorders. How do you diagnose a psychological disorder? The diagnosis enables professionals to use a common language with others in the field and aids in communication about the disorder with the patient, colleagues, and the public. A proper diagnosis is an essential element to guide proper and successful treatment. For these reasons, classification systems that organize psychological disorders systematically are necessary. So let's look at the primary tool used to diagnose psychological disorders. This is called the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. That is, again, the primary tool that psychologists or physicians perhaps would use to diagnose psychological disorders. Within that manual, each disorder is described in detail, including an overview of the disorder, specific symptoms required for diagnosis, prevalence information, in other words, what percent of the population is thought to be affected with that disorder, and risk factors associated with this disorder. The DSM-5 also provides information about comorbidity, which is the co-occurrence of two disorders. So let's look at an example. ADHD is a disorder most of us are aware of, and this is what the DSM-5 criteria would look like. You have to have greater than 5 symptoms per category in adults. 26 months, age of onset has to be less than 12 years, noticeable in greater than 2 settings, and has an impact on social, academic, or occupational functioning. I'm not going to go through all those criteria right there, but you can take a look and see what the criteria are in order to receive an official diagnosis of ADHD. So this is what a psychologist would go by to offer a diagnosis for ADHD. And if someone doesn't meet that criteria, then they're not going to meet the qualifications for a diagnosis. So that's a little bit about the basic ideas on origins of psychological disorders and how a psychologist would diagnose those disorders. As usual, thank you for listening, and let me know if you have any questions.